Many of us feel more confident when our hair is shiny and radiant. After all, our hair is our crowning glory. Even though our skin is our largest part of the organ, many of us take for granted our hair and our nails. But it can indicate a lot of potential problems or diseases that we may have. On the program today, we'll talk more about the signs your hair and nails may be revealing and the ways to keep them healthy and glowing. I'm Dr. Freddy Gomez and welcome to MedTalk Health Talk on CNN Philippines. From falling hair to brittle nails, it's vital to know what these body parts are telling you in order to address the underlying problems. Let's welcome our guests for today. With us is Dr. Claudine Yap Silva. She's the head of Dermatopathology Unit at the Medical City and the chair of the Philippine Dermatological Society Hair and Nails Subspecialty Core Group. Also with us is Dr. Maria Rica Malyari. She's the head of the hair unit in the Dermatology Center of the St. Luke's Medical Center in Quezon City and a fellow of the Philippine Dermatological Society. I'll start the conversation first with Dr. Claudine. So when it comes to our hair, syempre nowadays we have a lot of stressful events that have been happening lately. One of the side effects maybe of this is hair loss due to stress. Could you talk more about this, please?
Yes, so hair loss due to stress is called telogen effluvium. So what happens is it usually presents as hair shedding because we usually have hairs grow and then they fall out. So that's normal. But when you have telogen effluvium, your hairs, when they shed, it's more than 100, more than 150 hairs per day. A lot of things can actually cause this. One is, of course, severe emotional stress. But apart from that, any form of infection, thyroid disorders, nutritional deficiency, lupus can also cause this. So there are a lot of causes of telogen effluvium. And from the point of insult, meaning from when the stressful or traumatic event happens, to the time the hair starts shedding, that's usually within 2 to 3 months from the traumatic event.
Dr. Rica, pag-usapan naman natin ang pattern baldness. So this is a little bit different from the stress-induced hair loss. Could you talk more about this naman?
There are different causes of hair loss really, and there's a scarring type, the one that's permanent, where the hair follicles are destroyed, and there's the non-scarring type where the hair can grow back. One of the non-scarring type is your pattern hair loss. What happens in pattern hair loss, or what you call common baldness, nakakalbo, is the hair follicle becomes smaller and smaller for every hair cycle. There's a normal hair cycle, there's a growing phase, and then the hair follicle dies, and then it sits there and waits for a new hair to grow from the same root. So the new hair that grows, that's supposed to push the dead hair, should grow to the same thickness and length. But sometimes because of the genes, inheritance, and the presence of testosterone in our system, the testosterone is converted to DHT by a certain enzyme, 5-alpha reductase. And this, when the DHT levels on the scalp increases, the hair follicle becomes smaller and smaller.
Let's touch on treatment a little bit because, you know, there are a lot of treatments out there. It's a really big industry when it comes to trying to prevent or slow down hair loss. But let's talk about effectivity. How effective is this? Is it really possible to stop this genetic predisposition to baldness?
Yes, there are lots of products in the market, the internet. When you search, ang dami. Even when you go to the supermarkets, the grocery, drugstore, they will sell a lot of things that's supposed to make your hair grow, even the shampoos, the conditioners that's supposed to help with hair growth. Actually, for males, there's only 2 that's approved by the FDA to be effective for pattern hair loss, and it's minoxidil and finasteride. But for me, actually, the patient, the one who's experiencing hair loss, should first seek treatment with a dermatologist from our society to check if it's really pattern hair loss, because there could be an underlying medical problem. It might not be pattern hair loss really. So seek consult with a dermatologist first before getting these products.
Now, I'd like to talk about contact dermatitis, specifically those yung masyadong maraming nilalagay na products, the use of hair dyes, always those who color their hair. Dr. Dr. Claudine, could you talk more about this? What are some of the symptoms that the person may feel that their hair and their scalp is already being affected with all the products that they use?
So the most common cause of allergic contact dermatitis is from hair dyes is an ingredient called paraphenylenediamine. So what are the symptoms? What happens is after they place the hair dye, the patients may experience either itching, burning sensation. They may also get a little bit of dryness or scaling on this area. And sometimes the inflammation may be so severe that they can get really puffy, the entire scalp, and even the rest of the face.
In connection with that, is dandruff connected in some way to that? Or could you talk more about dandruff naman, Dr. Claudine?
Right. So dandruff is not really connected to contact dermatitis, to hair dyes, even if it also presents with some dryness or scaling of the scalp. No? What happens in dandruff? Dandruff is caused by like our skin's reaction to a yeast that's present in our normal flora. And it may be triggered by a change in humidity or a change in the temperature. So usually our patients with seborrheic dermatitis, this is like the scientific name or the medical term for dandruff. It usually happens during the colder months of the year, and they present with itching on certain parts of the scalp with some dry patches. And you can also have this on areas of the face. So for example, the eyebrows, the in between the eyebrow area, the sides of the nose, even the upper cheeks. You can have this on the ears. On the body, you can have it on the upper chest and upper back.
We'll talk more about ways to restore the look and feel of our hair later on in the show. But coming up, our nails and what they might be telling us. So stay with us. You're watching MedTalk Health Talk. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk. If you take a closer look at your nails, they might be giving you clues about your overall health. So let's talk about what signs your nails may give and the do's and don'ts of caring for them. So much like our hair, we often take our nails for granted. We can trim it, color it. But are there underlying symptoms that they can reveal? Dr. Rica, when it comes to our nails, are they made of the same material as our hair? What's the connection between the two?
Actually, the hair and nails are made out of keratin, so it's very thick. The nails are there to protect the skin because a lot of the fingernails and on the fingers and the toes, there are a lot of nerve endings, and the nails are there to protect it. That's why when, in certain times when you hit your toe or your finger, it's so painful because there are nerve endings there. So the nails are there to protect your fingers and the toes. And sometimes when you get problems with, like, if you go on a diet, you lose your hair, and you find changes also in your nails that show that there's some deficiency in your body, like vitamins or mineral deficiency.
When it comes to vitamin deficiency or other systems in the body, how can they show up in the nails? What will our nails look like kapag, let's say, may problema tayo with our circulation, with our heart?
Sometimes when you have first biotin deficiency, the nails become brittle. So if they're soft, the tips are a little bit broken off easily. When you have your iron deficiency, it becomes spoon-shaped. The curvature is not there anymore. It becomes flattened. And there are times also when you have the telogen effluvium that was mentioned by Dr. Claudine earlier, where you shed your hair. Sometimes the nails also develop lines. On the particular time that you develop the hair fall, when the stress was induced, the stressful event like getting sick with COVID, hair falls, and then the nails also develop a line. You find a line there under your nail, a transverse line that will actually coincide with the time that you had COVID. So they're more or less related.
Now, Dr. Claudine, when it comes to our nails, of course, we want to make sure that there are no infections here, nothing of that sort. But when it comes to fungal nail infections, could you talk more about this? And is this an easy condition to treat?
So fungal nail infection is also known as onychomycosis. And this usually arises in patients who are immunodeficient, and particularly in the elderly and patients who also are experiencing some states of immunodeficiency. So what happens is the nails will look roughened, and there may be, you will see like some scaling or some debris underneath the nails. They do not grow as well as, a normal nail or a healthy nail would look like. They usually arise on the toenails first, and you may have it on the fingernails afterwards.
Now, a common habit that might be causing damage is nail biting, because about half of the kids and teens bite their nails, and many carry them over to adulthood as well. Dr. Claudine, why do some people nail bite, and how does it affect our nails?
Yes. So nail biting may be a cause of maybe, secondary to emotional or mental stress. So, it's important to recognize this, as these stresses need to be addressed. Now, when we do nail biting, then we are more prone, or we have a greater risk for infection, because when we bite the nails, it's not impossible that you can also cause a break in the skin. And when this happens, then you give a chance for the microorganisms to come in, and they can cause an infection.
What's a good way for nail biters to stop the nail biting behavior?
One of the more important things to do is to recognize that you have it. And the easier, I would say, like, practical things to do would be, of course, like, you can cover the nails, you try to keep it short. You can even, there are things that you can already apply on the nail to make it not taste good or have like some bitter taste, so you end up not doing it. And of course, to address what is causing it, you have to, consult with a psychiatrist to see if this can be addressed. It's also, they can teach you how to do like behavioral modification for it as well.
Now, Doc Rica, you mentioned earlier about the hematoma on the nail because of trauma. And since we're talking about nail dystrophy, certain things, let's talk about that, especially pag sa paa, sa toenails, makikita yan sa mga mahilig sa sports, or ito yung tinatawag na patay na kuko. But aside from that trauma, is ill-fitting shoes a possible cause for this type of condition?
Yes, sometimes nail dystrophy or color changes in your nails can be due to ill-fitted shoes. But you have to address this also, because the discoloration on the underneath your nail can be another thing rather than a hematoma. It could be a melanoma, like cancer of the mole. It's like the change can be similar to a hematoma. So it has to be evaluated by a dermatologist if it's really caused by that. Regarding the nail dystrophy from ill-fitted shoes, because sometimes it causes nail changes, like it looks like a patay na kuko. Actually, it's not patay because it grows. But sometimes when you have this nail dystrophy, you can have a secondary fungal infection that will affect that certain toe. So it has to be addressed too.
Your nails say a lot about your health, so don't ignore any changes in it. So when we return, we'll take a closer look at ways we can keep them healthy and nourished. Your health is our mission here on MedTalk Health Talk. We'll be right back. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, where caring is our calling. Hair and nails can tell you a lot about a person's appearance, but they also play a part in keeping us healthy as well as safe. Now, this is why we need to take the time to give them the care that they need. So for both our hair and nails, we need to be extremely careful with the products we use and how we take care of them. So starting with our hair and how to take good care of our hair, Doc Rica, what's a tried and tested way to keep our hair healthy and strong?
First, actually, you have to eat a balanced diet, because there are some people who go on different kinds of diets nowadays, and it may cause deficiencies. So it's better to eat a balanced diet. Probably eat a little of everything, like your vitamins and minerals are very important. Number two is using the right shampoo and conditioner for you, because there are some who have curly hair. So you have to use a conditioner that has more conditioners and a shampoo that's good for curly hair. For also for oily hair, when you do procedures, like you have procedures done like your rebonding, perming, waving, straightening, you have to do it less frequently, as much as possible, 6 months, as far as 6 months apart before you do another one. If there's any problem, do not self-medicate. Actually, you have to consult with a PDS dermatologist to assess what's causing it, because there might be another problem that has to be taken into consideration and treated.
When it comes to our hair, Dr. Rica, is there an ingredient that our viewers must absolutely avoid? A chemical, an ingredient that they should look out for, whether it be in hair dyes, shampoos, or conditioners?
Usually, as a shampoos, they always talk about the sodium lauryl sulfate because it's harsh. Shampoos are there kasi to remove the sebum and dirt on your scalp and hair. And sometimes when these shampoos that contain SLS, they strip your hair of the oils and the sebum that's supposed to moisturize the hair shaft. So nagkakaroon ng brittle hair if you use these shampoos with sodium lauryl sulfate. But there are cases that you need to use these shampoos when it's so dirty. So you can use that first and then later on avoid shampoos with SLS. And then with regards to the hair dyes, usually it's the paraphenylenediamine, yung mga preservatives. Those are the things that causes your contact dermatitis. So as much as possible, avoid using products with those.
Dr. Claudine, when it comes to the term biopsy, normally our viewers would relate that to maybe a tumor or something really serious. But is this something that dermatologists use as well as determining diseases from the hair and from the nails? And how much information, how vital is a biopsy in this case?
Yes, so us dermatologists, we do a lot of biopsies because it really helps us clinch or confirm the diagnosis of our patients. And this is typically done as an outpatient procedure. So the patients don't have to be very anxious about this. It is, fast. It only takes a few minutes, 20 minutes probably at the most. And we are able to tell a lot from the biopsies. For the nails, then we can do like a small nail biopsy on certain areas, and we can also tell like which part of the nail is involved, what condition is causing the nail changes or the nail dystrophy.
Now, Dr. Rica, when it comes to our hair and the summertime ngayon, it's exposed to the sun a lot. What are some of the healthcare tips that you can give when UV rays are involved?
Yes, beach time. A lot of people, they spend time in the beach and it's long hours there exposed under the sun. So it's better to wear caps, hats, scarves, just to cover the hair, because the hair can become brittle with too much heat. So better to wear those hats and apply conditioner just to protect the hair shaft, so the hair will not become brittle.
And Dr. Claudine, do you have any final tips for our viewers when it comes to hair and nail care or skin care in general?
Of course, so skincare in general or hair and nail care, I think the most important is to eat a balanced meal or a balanced diet. As we mentioned earlier, a lot of nutritional deficiencies can also show up in our hair and nails. The second is too little is not bad. So, taking care of our hair by just doing regular shampoos and conditioners is good. For our nails, try to refrain from using nail polish very often. And if we really have to do cosmetic procedures on our hair and nails, for example, bleaching or dyeing or perming, and for the nails, if we have to do nail polishes, try to space it out as far as you can. And of course, if there are any problems on the skin, hair, and nails, always seek consult with a board-certified PDS dermatologist.
With that, I'd like to thank dermatologists Dr. Claudine Silva and Dr. Rica Malyari for being with us today and being the experts when it comes to hair and nails and skin in general. I'm Dr. Freddy Gomez, and we'll see you again next time.